The screaming started at 3:47 in the afternoon. Glass shattered against concrete as hundreds of people surged through the parking lot of Riverside Community Center, their voices rising in a cacophony of rage and fear. "Murderers!" someone shouted above the chaos. "They're poisoning our children!" The mobile vaccination clinic, which had been peacefully serving the underserved neighborhood just minutes before, now resembled a war zone. Dr. Sarah Chen watched in horror from behind an overturned table as her carefully organized medical supplies scattered across the asphalt. Vials of vaccines rolled into storm drains, while syringes crunched under the feet of the advancing mob. Her hands trembled as she reached for her phone to call for help, but the signal was jammed by the sheer volume of emergency calls flooding the local networks. "Get down!" Marcus Williams, a registered nurse who used a wheelchair, shouted to his colleague as a brick sailed through the air where her head had been seconds before. His dark eyes flashed with a mixture of fear and determination as he maneuvered his chair toward the emergency exit. "We need to evacuate now." The attack had materialized out of nowhere, transforming what should have been a routine Tuesday afternoon into something unrecognizable. Just 2 hours earlier, the clinic had been buzzing with quiet efficiency as families lined up for their scheduled appointments. Children clutched coloring books while parents filled out paperwork. The atmosphere had been hopeful, almost celebratory, as the community finally gained access to healthcare services that had been denied to them for far too long. Dr. Chen had spent months planning this initiative. As the daughter of immigrants who had struggled to access medical care, she understood the barriers that prevented underserved communities from receiving basic health services. Her mobile clinic program employed nurses with disabilities, recognizing their unique perspective on healthcare advocacy and their fierce dedication to patient care. Marcus, who had lost the use of his legs in a car accident during nursing school, had become one of her most trusted team members. His gentle manner with anxious patients and his encyclopedic knowledge of vaccine science made him invaluable to the program. Elena Rodriguez, a nurse with a hearing impairment who communicated through sign language and lip reading, had been administering vaccines with practiced precision when the first angry voices reached the parking lot. She had looked up from her patient, an elderly grandmother seeking her booster shot, and noticed the growing crowd outside the windows. Something in their body language had made her stomach clench with apprehension. "What's happening out there?" the grandmother had asked in Spanish, following Elena's gaze toward the entrance. Elena had signed her response while speaking aloud, a habit that helped her communicate with both hearing and deaf patients. "I'm not sure. Mrs. Gutierrez. Let me check with security." But there had been no time to investigate. The doors had burst open, and the mob had poured in like a flood of fury and misinformation. Elena had immediately moved to shield Mrs. Gutierrez, helping the elderly woman toward the back exit while chaos erupted around them. The careful order of the clinic dissolved into panic as medical equipment crashed to the floor and angry voices demanded the immediate shutdown of what they called poison distribution. The origins of this catastrophe could be traced to a single phone call made 40 minutes earlier from a pristine kitchen in the affluent Meadowbrook subdivision. Karen Mitchell, a 43-year-old real estate agent with perfectly styled blonde hair and a collection of designer handbags, had been scrolling through her social media feed when she stumbled upon a post about the mobile vaccination clinic. The image showed Marcus Williams preparing a syringe, his focused expression captured in profile as he worked. Karen's manicured fingers had tightened around her phone as she read the caption describing the clinic's mission to serve underrepresented communities. The sight of the disabled healthcare workers had triggered something dark and irrational in her mind. She had been simmering with resentment ever since the mask mandates had been reinstated, viewing them as government overreach that infringed upon her personal freedoms. The vaccination program represented everything she believed was wrong with the current healthcare system. "This is absolutely disgusting," she had muttered to herself, her voice echoing in the empty kitchen of her McMansion. Her husband was at work, her children at their private school, leaving her alone with her mounting frustration and access to both social media and emergency services. Karen had dialed 911 without hesitation, her voice taking on the breathless urgency of someone reporting a genuine emergency. "I need to report a medical emergency at Riverside Community Center," she had told the dispatcher. "There are disabled people injecting poison into children and elderly people. They're claiming it's vaccines. But I have evidence that they're actually administering dangerous chemicals. People are going to die if you don't stop this immediately." The dispatcher, trained to take all emergency calls seriously, had pressed for more details. "Ma'am, can you describe what you're witnessing? Are you at the location now?" "I'm monitoring the situation remotely," Karen had replied, her tone suggesting she was performing some kind of civic duty. "These so-called nurses are disabled individuals who clearly aren't qualified to be administering anything to anyone. One of them is in a wheelchair. For God's sake, how can we trust someone who can't even take care of themselves to inject substances into healthy people?" The dispatcher had remained professional, despite the concerning nature of the call. "Ma'am, mobile vaccination clinics are legitimate medical services. Are you reporting a specific medical emergency or injury?" Karen's voice had risen in pitch, taking on the shrill quality that would later become infamous in recordings released to the media. "This is a medical emergency. They're poisoning people under the guise of health care. I demand that law enforcement shut this down immediately before more innocent lives are lost." While Karen had been making her false report, Dr. Chen had been reviewing patient files with Marcus, discussing the afternoon schedule and the progress they had made in building trust within the community. The mobile clinic had been serving this neighborhood for 3 weeks, and word-of-mouth recommendations had steadily increased their patient volume. Families who had been hesitant to visit traditional medical facilities were finding comfort in the accessible, culturally sensitive approach that her team provided. "Mrs. Patterson called this morning to schedule her entire family," Marcus had reported, his wheelchair positioned beside the makeshift desk they had set up near the clinic entrance. "She said her sister recommended us after her positive experience last week." Dr. Chen had smiled, making notes in her tablet. "That's exactly what we hoped would happen. Trust builds trust, especially in communities that have experienced medical discrimination." Elena had looked up from her supply inventory, catching enough of their conversation through lip reading to join in. "The teenagers are starting to come in without their parents, too." She had signed and spoken simultaneously. "They're taking responsibility for their own health decisions." The sense of accomplishment and community connection had made the subsequent attack even more devastating. Dr. Chen had invested not just her professional reputation, but her personal savings into this program. She had fought bureaucratic obstacles, insurance complications, and logistical nightmares to bring accessible healthcare to communities that needed it most. The sight of her carefully assembled supplies being destroyed by an angry mob represented not just financial loss, but the shattering of a dream she had nurtured for years. The first police units had arrived within 12 minutes of Karen's call, but by then, the situation had spiraled beyond their immediate control. Social media had amplified Karen's accusations with frightening speed, as her initial posts about disabled people poisoning children had been shared thousands of times across multiple platforms. Each share had added new layers of misinformation and inflammatory language, transforming a single false report into a viral campaign of medical disinformation. "We've got reports of a mob forming at Riverside Community Center." The lead officer had radioed to dispatch as his patrol car approached the scene, requesting backup and medical units. This situation is escalating rapidly. The crowd had grown from Karen's initial post of a dozen concerned citizens to nearly 300 people within an hour. Parents clutched their children while shouting demands for the immediate arrest of the medical staff. Signs appeared, as if from nowhere, bearing slogans like "Protect our kids" and "Medical freedom now." The atmosphere had taken on the dangerous energy of a lynch mob, with individual voices lost in the collective roar of manufactured outrage. Dr. Chen had managed to evacuate most of her staff through the back entrance, but not before witnessing the complete destruction of equipment that had cost her clinic nearly $50,000. Refrigerated vaccines worth tens of thousands more had been scattered and destroyed, representing not just financial loss, but the denial of healthcare to hundreds of people who had been scheduled for appointments in the coming weeks. "This is insane," Marcus had said as they regrouped in the parking lot behind the building, his voice shaking with a combination of adrenaline and disbelief. "We're nurses. We took an oath to help people. How did helping people become grounds for mob violence?" Elena had been documenting the scene with her phone, capturing video evidence of the destruction while tears streamed down her face. As someone who had faced discrimination throughout her career due to her hearing impairment, she understood the power of prejudice to transform neighbors into enemies. But the scale and intensity of this attack had exceeded her worst fears about societal backlash against disabled healthcare workers. The police had eventually managed to disperse the crowd, but not before local news crews had arrived to capture the chaos. The evening news broadcasts had featured dramatic footage of the destroyed clinic, with reporters describing the scene as evidence of growing tensions over vaccine policies. The nuanced reality of disabled healthcare workers serving underserved communities had been lost in sensationalized coverage that focused on conflict rather than context. Dr. Chen had spent that night in her home office, surrounded by insurance paperwork and incident reports, trying to calculate whether her program could survive this attack. The financial losses were staggering, but the damage to community trust felt even more devastating. Patients who had been scheduled for appointments were calling to cancel, their voices filled with fear and confusion about what they had seen on the news. "Dr. Chen, I saw on Facebook that your nurses were arrested for giving poison shots," one patient had said during a phone conversation that evening. "Is that true? Should I be worried about the vaccine my daughter received last week?" The patients required to address each misconception, to explain the difference between medical care and the rumors circulating on social media, had exhausted Dr. Chen both emotionally and physically. She had spent years building her reputation as a healthcare provider, but a single false accusation had undermined that foundation in a matter of hours. Meanwhile, Karen had been monitoring the news coverage from her living room, a glass of wine in hand, as she watched footage of the chaos she had orchestrated. Her initial satisfaction at seeing the clinic shut down had gradually given way to a more complex mixture of emotions as the scope of the destruction became clear. She had not intended for anyone to get hurt, she told herself, but the disabled nurses had been engaging in dangerous practices that needed to be stopped. Her husband had returned from work to find her glued to the television, news reports playing on repeat as social media notifications chimed constantly on her phone. "What's all this about?" he had asked, loosening his tie as he surveyed the scene. "I helped expose a medical scandal today," Karen had replied, her voice carrying a note of pride mixed with defensiveness. "That vaccination clinic was using disabled people to inject experimental chemicals into children. Someone had to take a stand." Her husband had frowned, his expression skeptical as he watched the news coverage. "Karen, those look like legitimate healthcare workers. Are you sure about this?" "Of course I'm sure," she had snapped, her tone becoming sharp with irritation. "I did my research. I know what I saw. Those people had no business administering medical treatments to anyone. But even as she defended her actions, Karen had felt a growing unease about the intensity of the response her call had generated. The images of destroyed medical equipment and terrified healthcare workers had begun to penetrate her certainty, creating small cracks in the narrative she had constructed to justify her interference. The following morning had brought a new wave of complications, as parents throughout the region began demanding answers about the safety of vaccines their children had received at various medical facilities. Dr. Chen's clinic had been just one target, but Karen's accusations had cast suspicion on the entire healthcare system's approach to vaccination programs. Emergency rooms reported an influx of panicked parents seeking blood tests and medical evaluations for children who had received routine immunizations. We're seeing a massive increase in vaccine-related anxiety. Dr. Jennifer Walsh, chief of pediatrics at Regional Medical Center, had told reporters during a hastily organized press conference. Parents are bringing in healthy children demanding extensive testing based on misinformation circulating on social media. This is creating a strain on our emergency resources and preventing us from treating actual medical emergencies. The ripple effects had extended far beyond individual families to impact public health policy across the entire region. School districts had been flooded with requests for medical exemptions as parents sought to withdraw their children from vaccination requirements. Healthcare providers had received hundreds of calls from patients questioning the safety of treatments they had already received, creating a crisis of confidence that threatened to undermine decades of progress in preventive medicine. Dr. Chen had been contacted by state health officials requesting detailed documentation of her clinic's procedures and safety protocols. While she had welcomed the opportunity to demonstrate the legitimacy of her program, the investigation had required resources and attention that could have been devoted to patient care. Her staff members, already traumatized by the attack, now faced additional stress as they prepared to defend their professional qualifications and medical practices. "This feels like we're being put on trial for doing our jobs," Marcus had confided to Dr. Chen during a video call from his apartment. His usually optimistic demeanor had been replaced by a weariness that made him appear older than his 32 years. "Elena hasn't slept since the attack. She keeps having nightmares about angry crowds." Elena had indeed been struggling with the psychological aftermath of the violence. As someone who relied on visual cues for communication, the sight of hundreds of hostile faces had been particularly traumatic. She had begun experiencing panic attacks when surrounded by groups of people, a response that threatened to impact her ability to work in clinical settings where crowds of patients were common. The investigation into the attack had initially focused on identifying the ringleaders of the mob and determining whether any crimes had been committed during the destruction of the clinic. But as detectives had begun tracing the origins of the social media campaign that had sparked the violence, they had discovered a pattern of posts and communications that pointed to a single source. Detective Maria Santos, a specialist in cybercrime and social media investigations, had been assigned to analyze the digital footprint of the misinformation campaign. Her examination of sharing patterns, timestamp data, and account creation histories had revealed sophisticated coordination that suggested more than spontaneous community outrage. The initial posts all trace back to a cluster of accounts created within hours of each other. She had explained to her supervisor during a briefing 3 days after the attack. The language patterns and sharing behaviors suggest these weren't independent users, but rather coordinated sock puppet accounts designed to amplify a specific message. The breakthrough had come when Detective Santos had cross-referenced the timing of the social media posts with local emergency service records. The 911 call that had triggered the initial police response had been placed at 3:07 in the afternoon, exactly 11 minutes before the first inflammatory post had appeared on social media. This timing discrepancy had suggested that the caller and the social media campaign organizer were the same person. Phone records had confirmed Detective Santos's suspicions, revealing that all of the fake social media accounts had been created from IP addresses registered to Karen Mitchell's home address. More damning still, the emergency call had come from Karen's personal cell phone, despite her claims to dispatchers that she was reporting events she had witnessed in person. "We've got her," Detective Santos had told District Attorney Robert Kim during a meeting to discuss potential charges. She orchestrated the entire campaign, from the false emergency report to the social media disinformation that incited the mob. This wasn't a case of mistaken community concern. This was deliberate, coordinated harassment targeting disabled healthcare workers. The evidence had been overwhelming, but the legal challenges were complex. Karen's actions had taken place across multiple jurisdictions and platforms, involving federal communications laws, state emergency services regulations, and local ordinances regarding public safety. The case would require coordination between multiple agencies and careful attention to First Amendment protections, even for speech that had resulted in violence and property destruction. While the investigation had proceeded, Dr. Chen had been working to rebuild her program and restore community trust. The financial losses from the attack had been partially covered by insurance, but the intangible damage to relationships and reputation would take much longer to repair. She had organized town halls and community meetings, providing transparent information about vaccination science and addressing concerns that had been amplified by Karen's misinformation campaign. "I understand that many of you have questions about what happened at our clinic," Dr. Chen had told a gathering of community leaders and parents at the neighborhood association meeting. "I want to be completely transparent about our procedures, our staff qualifications, and our safety protocols. You deserve to have accurate information so you can make informed decisions about your family's health care." The community response had been mixed, with some residents expressing support for Dr. Chen's program, while others remained skeptical about the safety of vaccines in general. The attack had tapped into deeper anxieties about medical authority and government oversight, concerns that could not be addressed through simple explanations of scientific evidence. Marcus had returned to work despite his ongoing emotional trauma, recognizing that his visibility as a disabled healthcare professional was crucial to combating the stereotypes that had fueled Karen's accusations. His decision to continue serving patients despite the personal risk had inspired colleagues throughout the region and attracted national attention to the challenges faced by disabled healthcare workers. People with disabilities aren't looking for pity or special treatment, he had explained during an interview with a national news program. "We're qualified professionals who happen to have different physical abilities. The idea that our disabilities somehow disqualify us from providing excellent medical care is not just wrong. It's dangerous discrimination that ultimately hurts patients who could benefit from our unique perspectives and experiences." Elena had been slower to return to public-facing work, but she had channeled her experience into advocacy efforts aimed at improving security protocols for healthcare workers. Her documentation of the attack had become crucial evidence in the legal proceedings against Karen, and her testimony about the psychological impact of the violence had helped prosecutors understand the full scope of the damage caused by the false accusations. The turning point in public opinion had come when medical experts began speaking out about the qualifications and contributions of disabled healthcare professionals. Professional associations, medical schools, and hospital systems had issued statements defending the competence and value of workers with disabilities, providing scientific evidence to counter the prejudicial assumptions that had driven Karen's campaign. Healthcare workers with disabilities often bring enhanced empathy, problem-solving skills, and resilience to their practice. Dr. Amanda Foster, president of the American Nurses Association, had explained during a widely viewed press conference. They understand what it means to navigate complex medical systems, advocate for patient needs, and maintain dignity in the face of systemic barriers. These are exactly the qualities we should celebrate in healthcare providers. The medical community's unified response had helped shift the narrative from questions about disabled workers' competence to recognition of their valuable contributions. Stories began emerging of disabled healthcare professionals who had made significant advances in patient care, medical research, and healthcare accessibility. The attack on Dr. Chen's clinic was reframed as an assault on medical progress, rather than a legitimate expression of community concern. As the investigation into Karen's actions had progressed, additional evidence had emerged of her involvement in other harassment campaigns targeting healthcare providers and public health officials. Detective Santos had discovered a pattern of false reports and malicious social media activity stretching back several months, suggesting that the attack on the vaccination clinic was part of a broader campaign of medical disinformation. She's been systematically targeting healthcare facilities that serve minority communities. Detective Santos had reported to the district attorney. The vaccination clinic attack was just the most successful of her attempts to shut down medical programs she disagreed with. We've found evidence of false complaints to licensing boards, fraudulent reviews of medical practices, and coordinated harassment of individual healthcare workers. The scope of Karen's activities had shocked even experienced law enforcement officials who were accustomed to investigating online harassment cases. Her systematic approach to undermining public health initiatives had required significant time, resources, and technical sophistication. The revelation that a single individual had orchestrated such widespread disruption had raised questions about the vulnerability of healthcare systems to coordinated disinformation attacks. The national debate about vaccine safety and medical freedom had reached a crescendo as Karen's case gained widespread media attention. Cable news programs had featured heated discussions between medical experts and vaccine skeptics, with Karen's actions being cited as evidence by both sides of the controversy. Supporters had portrayed her as a concerned citizen, exercising her right to question medical authority, while critics had condemned her false accusations and the violence they had incited. This case represents a dangerous escalation in the war against scientific expertise. Dr. Michael Harrison, director of the National Institute of Health Communication, had argued during a congressional hearing on medical misinformation. When false accusations can destroy legitimate medical programs and endanger healthcare workers, we're facing a public health emergency that threatens the foundation of evidence-based medicine. Congressional representatives had been divided in their responses, with some calling for stronger penalties for false emergency reports, while others had expressed concern about potential restrictions on free speech. The complexity of the legal and constitutional issues involved had made legislative solutions difficult to develop, leaving enforcement agencies to pursue individual cases under existing laws. The climax of the controversy had occurred during a nationally televised town hall meeting, organized by a major news network to address vaccine hesitancy and medical misinformation. Dr. Chen, Marcus, and Elena had been invited to share their experiences, while Karen had been offered an opportunity to explain her actions and respond to the charges against her. The televised confrontation had been watched by millions of viewers as Dr. Chen had calmly presented evidence of her clinic's safety record and the qualifications of her staff. Marcus had spoken eloquently about the discrimination faced by disabled healthcare workers, while Elena had used sign language interpretation to address misconceptions about her ability to provide safe medical care. Karen's appearance had been less successful, as her attempts to justify her actions had been undermined by the mounting evidence of her coordinated disinformation campaign. Her claims of being a concerned citizen had been contradicted by the sophisticated nature of her social media manipulation and the systematic pattern of her harassment activities. "I was trying to protect people," Karen had insisted during the televised discussion, her voice taking on the defensive tone that had become familiar to viewers following the story. These disabled individuals were administering untested chemicals to vulnerable populations. Someone had to take a stand against this medical experimentation. Dr. Chen had responded with controlled professionalism, presenting documentation of her clinic's regulatory approvals, staff certifications, and safety protocols. "Ms. Mitchell, every vaccine we administered was FDA approved and recommended by the CDC. Our staff members are licensed healthcare professionals with years of training and experience. Your accusations were based on prejudice, not medical evidence." The contrast between Dr. Chen's factual presentation and Karen's emotional appeals had been stark, highlighting the difference between evidence-based healthcare advocacy and fear-driven misinformation. Fact-checkers had real-time verification of claims made during the broadcast, providing viewers with immediate access to authoritative sources that supported Dr. Chen's position, while contradicting Karen's accusations. The public response to the town hall had been overwhelmingly supportive of the healthcare workers, with social media sentiment analysis showing a significant shift in opinion toward recognizing the value of disabled medical professionals. Donations had poured in to support Dr. Chen's clinic rebuilding efforts, while professional organizations had launched initiatives to promote careers in healthcare for people with disabilities. The legal proceedings against Karen had culminated in her indictment on multiple felony charges, including filing false police reports, inciting violence, harassment, and cyberstalking. The evidence against her had been overwhelming, with digital forensics clearly documenting her role in orchestrating the disinformation campaign that had led to the destruction of the clinic. During her arraignment, Karen had appeared subdued and isolated, lacking the confident demeanor she had displayed during her media appearances. Her legal team had attempted to negotiate a plea agreement, but the severity of the charges and the extensive damage caused by her actions had made prosecutors reluctant to accept reduced penalties. The defendant engaged in a systematic campaign of harassment and disinformation that endangered public health and safety. Assistant District Attorney Jennifer Rodriguez had argued during the hearing, her actions resulted in property destruction, emotional trauma for healthcare workers, and widespread disruption of medical services for vulnerable communities. These charges reflect the serious nature of her crimes and the need to deter similar conduct in the future. Karen's conviction had been swift and decisive, with the jury deliberating for less than 4 hours before returning guilty verdicts on all counts. The evidence had been too overwhelming, and the pattern of behavior too clear for any reasonable doubt about her culpability. Her sentencing had included substantial fines, community service requirements, and restrictions on her use of social media platforms. The aftermath of Karen's conviction had brought a measure of justice to the healthcare workers she had targeted, but the broader implications of the case had continued to reverberate throughout the medical community. Professional organizations had developed new protocols for protecting healthcare workers from harassment and disinformation, while law enforcement agencies had improved their procedures for investigating false reports that targeted medical facilities. Dr. Chen had successfully rebuilt her mobile clinic program, with expanded security measures and enhanced community outreach efforts. The support she had received from professional colleagues and community members had enabled her to not only replace the destroyed equipment, but to expand her services to additional underserved neighborhoods. The clinic had become a symbol of resilience and the importance of evidence-based healthcare for all communities. Marcus had been recognized with numerous professional awards for his courage in continuing to serve patients despite the threats and harassment he had faced. His advocacy for disabled healthcare workers had led to policy changes at medical institutions throughout the region, improving accessibility and reducing discrimination in healthcare employment. His story had inspired a new generation of disabled students to pursue careers in medicine and nursing. Elena had channeled her experience into developing training programs for healthcare workers on managing crisis situations and supporting colleagues who face discrimination. Her expertise in nonverbal communication had proven valuable in creating protocols for serving deaf and hard-of-hearing patients, expanding access to healthcare for people with sensory disabilities. The community that had been divided by Karen's misinformation campaign had gradually healed, with many residents expressing regret about their initial response to the false accusations. Community leaders had organized educational forums about vaccine science and healthcare accessibility, helping to rebuild trust between medical providers and the populations they served. The case had become a landmark in legal precedents for addressing social media-driven harassment and disinformation campaigns. Law schools had begun teaching courses on cyberstalking and digital evidence collection, preparing future attorneys to handle similar cases involving online manipulation and false reporting. The techniques developed by Detective Santos had been adopted by law enforcement agencies nationwide for investigating complex social media crimes. In the months following Karen's conviction, public health officials had reported improvements in vaccination rates and reduced hesitancy about medical care among communities that had been affected by the misinformation campaign. The transparency and accountability demonstrated by Dr. Chen and her team had helped restore confidence in healthcare providers and the institutions that support them. The long-term impact of the case had extended beyond immediate justice for the healthcare workers involved to broader social recognition of the contributions made by people with disabilities in all professional fields. Employment opportunities for disabled workers had expanded as employers recognized the value of diverse perspectives and experiences in their organizations. Dr. Chen often reflected on the journey from that terrifying afternoon when her clinic was destroyed to the present day, when her program served as a model for accessible healthcare delivery. The experience had tested her commitment to her mission, but ultimately strengthened her resolve to provide quality medical care to underserved communities. The support she had received from colleagues, patients, and community members had demonstrated the power of truth and evidence to overcome fear and prejudice. As she prepared for another day of serving patients at her rebuilt clinic, Dr. Chen felt a deep sense of gratitude for the opportunity to continue her work and a profound respect for the resilience of her team members who had refused to be intimidated by harassment and violence. The mobile clinic continued to serve hundreds of patients each month, providing not just medical care, but hope for communities that had been overlooked by traditional healthcare systems. The story of Karen's false accusations and their consequences had become a cautionary tale about the dangers of misinformation and the importance of protecting healthcare workers from harassment and discrimination. But more importantly, it had become a story of triumph over adversity, of professional dedication prevailing over prejudice, and of communities coming together to support the healthcare providers who serve them with skill, compassion, and unwavering commitment to healing.